welcome. Professor Rich RN here. Today we're going to go over fundamental NCLEX questions in your preparation for either your fundamental courses or NCLEX prep. A nurse identifies pediculosis humanis captis. Considering the possible complications of treatment, the nurse knows to not use which of the following treatment products: A, a fine-tooth comb; B, pediculicide; C, Lindane base shampoo; D, vinegar hair rinse. Okay, your correct one for this one is going to be answer C, Lindane based shampoo. Products containing lidane, a toxic ingredient, often causes adverse reactions. So you want to instruct your patients who have head lice, because that's what we're dealing with in this question is lice, head lice, who have head lice, to shampoo thoroughly with a pediculicide. Sorry if I'm mispronouncing that, but which is available at our drugstores, and that's going to kill the head lice. They should be done in cold water, and we should be using a fine-tooth comb, which will help get rid of that. A dilute rinse with vinegar also can help the head lice as well. So the only one that is not indicated for this is that Lindane based shampoo for head lice. The other ones we can all recommend. A parent calls the school nurse with questions regarding the recent school vision screening. The Snellen chart examination revealed a 20 out of 60 for both eyes. Considering the visual acuity results, the nurse informs the parent that the child, A, should have an optometric examination, is suffering from strabismus; C, may have presbyopia; or D, has vision issues, most likely due to cataracts. Okay. So the answer for this one is A. So correct normal vision is going to be considered 20/20. The larger the denominator, okay, and that denominator is larger, it's 60, mean the poorer that the patient's visual acuity is. So the 20/60 means that the patient, when standing 20 feet away, can read a line that a person with normal vision can read at 60 feet away. Okay. During a routine pediatric history and physical, the parents report that their child was a premature infant and was so small that he had to stay in the neonatal intensive care unit longer than usual. They state that the infant was yellow when born and that he developed an infection that required every antibiotic under the sun to cure him. Considering the neonatal history, the nurse determines that it is especially important to perform a focused blank examination. So we got a cardiac, B, respiratory; C, ophthalmic; or D, hearing acuity. Okay, so the correct answer on this one is going to be D, hearing acuity. Okay, so risk factors for hearing problems include low birth weight, non-bacterial infections, and excessive high bilirubin. Surmise that they had some bilirubin issues because they said that they were yellow when they were born. Hearing loss due to ototoxicity. Injury to the auditory nerves can result from high maintenance doses of antibiotics, which the parents state they had antibiotics. And eye examinations are important assessments, but not relevant to this child's condition. So again, because of the jaundice or the yellowing, because of the antibiotics, the most important assessment is to do hearing acuity. During a sexually transmitted illness presentation to high school students, the nurse recommends the HPV vaccine series to prevent A, cervical cancer; B, genital lesions; C, vaginal discharge; or D, swollen perineal tissues. Hopefully we got this one right. The correct answer is A, cervical cancer. So human papillomavirus infection increases the person's risk for cervical cancer. So they recommend that they get this vaccine anywhere for between the ages of 9 to 26 years old. A male student comes to the college health clinic. He hesitantly describes that his testes has lumps. The nurse recognized this as a potential sign of which of the following: A, inguinal hernia; B, sexually transmitted infection; C, testicular cancer; or D, diuretic use. Okay, so the correct answer on this one is going to be C, testicular cancer. So irregular lumps on the testes may indicate potentially cancer. Um, Testicular cancer is the most common form of cancer in men between the ages of 15 and 35 years of age. So his age also plays a role in this. A hernia is going to be something that's going to be bulging out of the stomach, lower abdominal, or groin type area. So it's not going to be that one. A sexually transmitted disease also is going to have some sort of lesions or some discharge coming out. Diuretics and sedatives can be difficult to diuretic use or sedatives can be difficult for males to achieve erections, but it's not going to affect any sort of lumps or anything like that on their testicles. So again, the correct answer on this one is going to be C, potential for testicular cancer. All right. So the nurse is urgently called to the gymnasium regarding an injured student. The nurse is crying in severe pain with a malformed fractured lower leg. The proper sequence for the nurse's initial assessment is deep palpation, light palpation, inspection. B, light palpation, deep palpation, inspection. C, inspection, light palpation. D, auscultation, deep palpation, and light palpation. Think this one through, and I think you should get this one. Okay, so the correct answer for this one, of course, is going to be C. So we're going to inspect this site first. All right, so we're going to look through it, and then we are going to lightly palpate after that to look for areas of tenderness, moisture, and texture. Deep palpation is something that we're going to do if we're looking at organs. Right here, it's a fracture on the lower leg, so we're not going to deep palpate it at all. And again, deep palpation would only occur if we were to do it after the light palpation. Okay. Auscultation is used to evaluate the sound with that. But again, C, inspection and light palpation.